So based off the scenario, the critical thinking questions, the first impression of this patient's actions and appearance. I suspect the patient is suffering from the early onset of Alzheimer's disease. To provide a little background information on Alzheimer's disease, it is the most common form of dementia, which is caused by neurons in the brain dying off and no longer being able to function normally with communicating to other brain cells. Alzheimer's, also known as senile dementia, affects 5.2 million Americans, with 2 million of those accounted for being early onset signs of Alzheimer's disease. So let's break down the scenario and assess each sign and symptom that the woman is displaying and compare that to the earlier signs of Alzheimer's. So for one, the age of the patient, the woman's age of 54 years old is around the time that Alzheimer's sets in, usually full blown at 65 years old. Some patients can experience earlier signs of the disease before that 65-year-old range. Next thing, the location where she was found. A jogger had spotted her wandering around in a nearby park, shouting obscene. Alzheimer's affects thoughts, memory, and language. Those patients with Alzheimer's can appear aggressive, fearful, anxious, and sometimes found wandering around away from home without any recognition of how they got there and what they're doing there. The patient's state and appearance we can assess. The patient was wearing dirty clothes and that smelt of stale body odor and urine. This goes in line with Alzheimer's as it affects patients' ability to carry out normal daily activities, tasks such as showering, driving, and combing one's hair. The patient shows poor judgment and is less concerned with personal grooming habits and cleanup after themselves. The next sign to assess is the patient's behavior. She was noted as being aggressive at the park and appeared disoriented and combative at the hospital. The patient also accused the EMS team of stealing her purse and requested a bottle. These signs correlate to the changes in mood and personality associated with Alzheimer's disease. Patients are easily upset and irritable when they are out of normal routines and away from their homes. Memory, cognitive, and reasoning skills are significantly declined in Alzheimer's patients, where they are unable to recall name of family members or locations of personal belongings, so they end up blaming others for misplacing them. When she asked for the bottle, it became prevalent that she is unaware of the date or realize any general time that's passed. The short and long-term health risks that would associate with the patient that they face in the future. The Alzheimer's disease isn't fully understood, but it appears to be a slowly developed disease that begins with mild memory problems and advances to severe damage to the brain. There are some short-term and long-term health risks that the patient will face in the future. The short-term is short-term memory failure, issues learning and responding to new information, disorientation, mood and personality changes, restlessness, and the inability to perform normal daily tasks. Long-term effects can progress to the inability to recognize family members or even themselves, violent behaviors, incoherent speech, repetitious behavior, weight loss, and then patient in the latent stage of Alzheimer's are no longer able to swallow, talk, walk, or even sit up without assistance. Normally, patients with Alzheimer's die of infection and complications. The assessments that I think are needed for this patient, since Alzheimer's can be accurately identified until the patient is dead and their brain tissue examined during autopsy, the only way would be the patient for more information is to assess their history for certain risk factors that can lead to dementia like Alzheimer's, such as heart disease, diabetes, high blood pressure, stroke, recent head traumas, viral infection, exposure to toxic chemicals, and any record of possible family members with the disease. I would also assess the patient's diet, lifestyle, regular activity level, as those can be factors related to dementia and Alzheimer's. If family and friends are present at the hospital, I would ask them the same questions regarding the patient, and just in case the patient is distracted or less cooperative. Besides evaluating the medical history, there's neuropsychological tests that can be done, and then brain scans would also help to form a better diagnosis to the patient's signs and symptoms. For the research question, for mental illness, including both pharmacological and other therapeutic methods, what would those be, and then how this is managed, supported by insurance. So unfortunately, there's no cure for Alzheimer's, so the combination of pharmacological and other therapeutic methods can help slow down the progress of the symptoms, manage cognitive function, and help manage behavioral challenges. So the pharmacological management would be medications like donepezil, galantamine, and then mebutamine are commonly medications used for treating patients with Alzheimer's. The activation of NMDA has been a link to Alzheimer's. So the NMDA inhibitor, mebutamine, is used for patients with Alzheimer's disease. Other medications such as donepezil and galantamine are reversible inhibitors of the enzyme, which can be useful to patients as well. Additional medications include haloperidol, alprazolam, lorazepam, buspirone, risperidone, and then olanzapine. Supplemental prescription medication known as Azona, vitamin B12, and a combination of vitamins produced called surifolin are also used to treat cases with Alzheimer's disease. For insurance, probably need to confirm the diagnosis from a doctor and receive a doctor's order for sent to the pharmacy for most insurance companies to cover the recommended medication. Otherwise, Medicare has a specific program for individuals with dementia and Alzheimer's. Those who qualify are people 65 years and older can receive Social Security retirement benefits. Otherwise, there's also ones for younger than 65 receiving Social Security disability benefits for at least 24 months. The therapeutic management would be herbal remedies, dietary supplements that enhance memory and helps delay symptoms of dementia and Alzheimer's disease. Some of these include huperzine A, omega-3 fatty acids, coenzyme Q10, phosphatidylserine, coral calcium, trimethoxate, caprylic acid, and then ginkgo biloba. So the Capric acid is a fat chain produced from coconut oil and palm oil. The body breaks down the acid into substances called ketone bodies, and that's what can provide an alternative energy source for brain cells instead of the glucose that they usually use, since with Alzheimer's disease that ability is depleted, so they'll use that fat instead. The ginkgo biloba, used for, it's a Chinese tradition medicine. It has both antioxidants and anti-inflammatory properties. It's used to protect cell membranes, regulate the functioning of neurotransmitters. It's currently used for cognitive systems or symptoms associated with the neurological conditions. Okay. And that's it. Thank you.